Hello everyone, I am Dr. Rubina Pandit. I am a fertility consultant at Nova IVF Center, Bangalore. Today I will be discussing in brief about egg donation program. So oocyte donation is a method of assisted reproduction in which one female donates her eggs which help the other female to have a baby. The donor egg can either be fertilized using husband's sperm or donor sperm. Now, what are the indications of using donor egg? One is advanced maternal age. Second is diminished ovarian reserve. Third, it can be premature ovarian failure, which can happen as a result of autoimmune disorders or chemotherapy, surgical menopause, or it can be unexplained. Fourth indication, any female who is carrying a genetic mutation or any genetic disease which she does not want to be transmitted to the child can also opt for a donor egg cycle. Now, when I talk about donor egg, there are very strict guidelines from the ICMI. One, the donor has to be anonymous. A relative, a friend cannot be used as a donor. The donors are usually young, they are healthy, and they usually have one living child of their own. So that is an indirect indicator that the egg quality of the donor is good. After that, the donor is screened for all the infectious diseases as well as the general health checkup is done. Only once the screening procedure is over, the legal formalities gets completed, the donor is recruited into the program. Now, once the donor is selected, then the donor as well as the recipient cycles are synchronized using birth contraceptive pills. So, on second day of her cycle, the recipient is started on estrogen tablet to prepare her uterus. On the same day, the donor is started with the injections which help the eggs to grow. So, after 10 to 11 days of injections, by a simple procedure, the donor eggs are taken out. Now, based on the patient's profile, the donor's eggs are either fertilized using husband's sperm or donor sperm. So, on the day of fertilization, the recipient is started on the luteal support, and after 5 days, 1 or 2 good quality embryos are transferred into the recipient uterus, and whatever extra embryos are left, they are frozen for further use. So, in case if you have any other doubt, you can always mail us or you can drop in the center for further discussion. Thank you.